it's up to the patient to decide where they're going to go to get advice and healthcare and medicines. This is a call out for the patients to be really critical of your healthcare provider right now.
I'm Jeremy Prest, filling in for Leon today. After decades of nursing experience, my guest today had a front row seat to witness red flags of pandemic measures and the stress on the healthcare providers in British Columbia. Since she has launched Ezra Wellness, which she calls health promotion and disease prevention, here to share her story and provide insight and hope about the strained and dysfunctional Canadian healthcare system.
Today, a special episode of Return to Reason, where knowledge and wisdom intersect.
Svetlana, welcome to the show. It's so good to have you here.
Thank you, Jeremy, for having me. It's great to be here, and hello from Miami, Florida.
Over these last couple of years, I think we've really seen the flaws or the chinks in the armor, I guess you could maybe say, in regards to our healthcare system. What were some of the things that you noticed with your expertise with our healthcare system?
Yeah, actually, you know what? And I don't even call it a healthcare system. I actually call it the sick care system. So, being in the system for over 20 years, I was really never encouraged to practice health promotion and disease prevention. A lot of the things, we treat diseases and we treat sickness, but we never, promoted health and wellness. So I think it's a great time in history to really reflect on, where we've come from in the sick care system and how do we want to plan something new and move forward into the healthcare system, the well care system, health and wellness. How do we want to, promote health and prevent disease so people do not get sick?
I think I get what you're saying, but you're saying it's more or less treating the symptom and not the cause. Would you agree?
Well, I mean, they often go together. But maybe we could just back up just a little bit and we can talk about, what brought us here and why we're even having this conversation in the first place. So, back in 2020, January specifically, there was, something called the COVID-19 viral illness. And this basically stopped the world, starting in Wuhan, China. And it spread right to North America, Canada, Alberta, BC, and the rest of Canada. So it's really affected everybody's health and wellness and family and employment. So, there was a red flag for me right at the beginning of March of 2020 when I realized that this was not truly a healthcare emergency. This was something far greater. And I noticed a billing code from the BC government medical services plan for COVID-19. Anybody knows about billing codes? It takes probably at least 10 months to process. A billing code is something that the physicians use to basically charge the medical services plan of BC, health diagnosis for somebody. So right after, the pandemic was announced, there was a billing code for doctors to use. To me, this was a huge red flag, and we continue to have these red flags, and healthcare professionals started to communicate, through different chat groups right across the country. And we realized that we all had the same thing happening. And this was one big, lie. Yes, there were people getting sick and ending up in the emergency and ICU, but you know what? People always end up in the ICU and emergency. That's actually a normal thing. So, last October 26th of 2021, approximately 4,000 registered nurses in British Columbia were terminated for refusing the mandatory vaccine. This crime against humanity, will be something that's, has left a legacy forever. And we really need to understand what happened, why it happened, who was in control of it, and learn from this experience and move forward. We have a lot of hopeful resources and opportunities coming up in Canada and North America, but we need to team up with the right people, alignment, and make this project move forward.
Just to flesh out the thought about the code. So you're saying normally a code comes across for some sort of whatever the issue it is, and it takes months usually. And you said it came out in a very little time.
So the middle of March, Justin Trudeau announced that there was a deadly virus that was going to sweep across the country and basically kill people. Okay. A respiratory illness that's going to, be very difficult for people to get through health-wise. Yeah. So what happened there is most physicians' offices in Canada have something called an EMR, electronic medical record. This is how they do their doctor's notes, nurses' note. This is how they bill the government. There's so many diagnoses out there: hypertension, diabetes, depression, infection, insomnia, and so on and so forth. COVID-19 became a formal diagnosis where physicians could bill the Medical Services Plan of British Columbia within 2 days. Within 2 days of Justin Trudeau announcing the pandemic, 2 days later, in little old Christina Lake, British Columbia, a small little rural town of about 2,000 people, we had the billing code already ready to go. So to me, this was a very clear, organized, structured plan on the part of, our Canadian, corrupt government. And it was implemented, which encouraged the physicians to keep up with the narrative so they continue to get paid. And I believe this is the reason why we have seen very little physicians step out of their, role, which they should be, holding up the Hippocratic Oath, do no harm model of care. But the money is being used to tie them in there. But at the end of the day, we all had a choice of what we wanted to do: support the narrative, or, stood for, the patient and being the best patient advocate that we possibly can. And we saw an exodus of a large amount of amazing healthcare professionals 1 year ago from BC. And I know Alberta was really affected as well by the mandates.
Yeah. Now, I notice you're using a lot of words like pandemic, genocide, but you're speaking from a place of experience, from the things you saw, all the things that because you were frontline, correct?
Yeah. So, my background in nursing is intensive care unit, emergency, community health. Yeah. My last 7 years was a primary care nurse working in a doctor's clinic, basically working as a nurse practitioner level. So I've had, a plethora of nursing experience.
Yeah. There's so many different angles I kind of want to flesh out here in regards to the healthcare system. Like you said, what did you call it again?
Well, currently I call it the sick care system.
But what could the healthcare system do to get to a place where it's no longer, where it gets to a preventative place? Is there a healthcare system that could ever get like that?
Yeah, you know what? I think actually this is where we need to start branching off to privatization of healthcare. Mm-hmm. There needs to be a competition for the current, social and public system. Mm-hmm. The public system cannot be, the one and only standard of care. There needs to be competition and privatization. I mean, we've already seen it. We see the naturopaths and the chiropractors, the massage therapists, the dentists. We see them, doing their, their model of care. And I think it's now time for physicians and surgeons and nurses to step out into that role and to be encouraged to do that. And really that's what I'm, attempting to do. And I'm actually doing it. And the response has been overwhelmingly positive because, Alberta and the rest of Canada are looking for an alternative source that they can trust. And I think trust has been completely blown in the last 2 years. And people now are starting to think critically about their health, which is actually moving in the right direction, as opposed to just going to your physician and letting them tell you, what to do. The goal is for somebody to be empowered with information and tools to know where to go, and then actually have access when they need that care.
Well, that's very well said, because over the last couple of years, we've seen that if you just asked a question, you were almost pushed into a corner of conspiracy theorists just by asking questions. But I've seen multiple media streams all showing the flaws over time, where the system recommended this and this was incredibly bad, and it turned out 20 years later they found out. And so it's a good thing to ask questions. It's a good thing to dig and to be able to advocate for yourself. So you mentioned that you're currently in you're providing healthcare. What is it that you're doing right now?
Yeah, so when October of 2021 came around, this was last year, I saw the writing on the wall. We had Bonnie Henry and Adrian Dix, these are the health minister team of British Columbia, saying, okay, nurses, you don't take the vaccine, well, you're fired, without pay. And I knew, well, I was going to be one of those nurses, because there was no way in heck that I was taking that vaccine. And, working with the patients, I had the opportunity to, do my own research. And I was asking them, if there was an opportunity for you to hire a nurse,
Yeah.
privately, would you consider that? And 8 out of the 10 patients that I asked on a daily basis said yes. So I knew there was a market for this because they weren't getting the care that they were, wanting. Everything transferred to the phone. And the phone's okay, but you need to have some sort of, time to talk to people. So I started this Ezra Wellness Network, and it was in a time of, where basically the government was saying I was not allowed to practice nursing. Well, you know what? I know what's best for the patients, and I enjoy patient care and working with complex issues and families. So, this was something that I resurrected, and currently it's a mobile and remote resource. And we provide, nursing consultations. We provide referrals for all over Canada. I'm connected to as many healthcare professionals across the country to help provide, patients and families. Families are in a real dire situation. This is a huge thing. So we try to deploy nurses to, these specific communities to help these families along and advocate for them, because the system is a very complex one at the moment. So I work really, remotely, on the Ezra phone basically, and people call and text me, and I help them with many different, problems, right from the viral illness to, where do I find a surgeon, for example. So, there's not only me, but I work with a team of healthcare providers, other nurses and physicians who are in the same boat as me. And we are trying to, restart the wellness system, really just pure in service. And, there's nothing, we just want to help people and bring this truth to light.
What, as a healthcare professional, what is it that you wish a lot of these people knew, like that they had access to?
I think, early preventative care is the best,
Yeah,
and this
sure.
really goes back to, the first thing we all should be doing is exercising. Our bodies crave movement, and that's actually how we build a strong, healthy immune system. So, we need a robust immune system to be able to tackle, all these, viral and bacterial things and parasites that we just have in our environment, whether they're man-made or natural. So exercise is number one. You are what you eat. Making healthy food choices is really important, and then after that, we have our plant-based medicines, for example, ivermectin. So, there's a lot of things that we can be doing. And my job, I think, and I'm excited about, is to help empower people to make those healthy choices. And when they need access to care, I'm there for them along with other healthcare professionals.
When you're treating people and you're dealing with people from whatever side of the political spectrum, what have you noticed that, like informed consent, when that was, it almost seemed as though that went out the window. What did you notice in your field with informed consent when it came to the patient?
Yeah, informed consent is central to all patient care that we provide. You need the patient's consent in order to move forward with any type of working relationship. So, the extreme coercion and segregation around, for example, the vaccine was absolutely off the charts. We've never seen this type of force and pressure and shame before, at least not in my 25 years of career. So there was really no informed consent. To tell somebody, take a shot or lose your job, that is just absolutely primitive and absolutely criminal. So patients really had no choice. They were trusting their care provider at the time, whether it was a doctor or a nurse, and they just, they took it like, well, hey, I guess I should. And, even the flight issue, not being able to fly if you didn't have the vaccine. So there was everybody had a choice, but I do understand, why people were so pressured into doing it. If the choice is either take the vaccine or keep your job. Well, a lot of people need to keep their jobs and pay their mortgage and
Yeah, it's very much a bullying tactic. You know what I mean? Do this or else this. And so, and to play the devil's advocate, I've talked to people on the other side who were just so scared because they didn't know what was going on, and they thought that was the wisest thing because they trusted these people. And so to those people who don't know or didn't know, informed consent is exactly what you're saying. What would you say entails? Like in some of the stuff that I came across in your practices is the 5 rights of an individual. What are those?
Yeah. So as a nurse, I've literally given out thousands of medications before. And before you give out a medicine, you always, it's a rule, and all the nurses, all the good nurses out there know what I'm talking about. So there's always 5 rights to a medication: right patient, right time, right route, right dose, and the right to refuse. Every patient or client has the right to refuse a medication. So, and that without judgment, without, causing, any type of mental distress on them. That's their right. So the government absolutely overstepped this huge, huge line in the 5 rights of medication administration.
And to be clear, that's taught to you guys as nurses. Is that correct?
In nursing school, that's drilled into us daily, because it's really, with it's a great responsibility to administer medications. There's a huge, if you're not on the ball, you can be making massive amounts of medication errors, and this could cost people their life. Yeah. So for these 5 rights of medication rules to be thrown out the window was a huge absolute thing for nurses to stand their ground. And that's why we saw at least 4,000 nurses be terminated in BC last year, because they will not comply with this agenda.
One of the things that I wanted to ask you about was healthcare reform. Who should these decisions come to? Who should be advocating for this?
This is a big question. So we have to look back at the model that we've come from, and that was the big pharma model. That was a business model that they, strategically, came up with, and years later, here we are with, Pfizer and Moderna and Johnson and Johnson, basically, ruling the roost in the healthcare system. So moving forward, we really need to recognize, who the players are, and we don't want to play with those players. They're going to keep going and doing their thing, but I'm disregarding them, and we are planting something that is based on just pure goodness, service, disease prevention, health promotion, aligning with the right healthcare professionals. And at the end of the day, Jeremy, it's up to the patient to decide where they're going to go to get advice and healthcare and medicines. This is a call out for the patients to be really critical of your healthcare provider right now. Whoever it is, just look at them. Do they look healthy to you? That's the first step. Somebody who is a physician or a nurse who's a smoker and overweight, to be honest, I wouldn't want to go see them. If they're not practicing what they're preaching, then really, is that the best care you're providing? So it's a time for, it's blooming. The new wellness system is blooming all over North America, and it's up to the patients to do their homework, to do their research. And it's not only physicians and nurses and naturopaths and chiropractors. Like, get out, like your personal trainers. Get to the gym. They know so much. So this is all inclusive of people who want to do health and wellness coaching as well.
Well, absolutely. Like, one of the things is, this is just a different way that I think, is that I wouldn't take financial advice from somebody who was not financially well. Like, so why in the world would you do it with somebody who doesn't? And like, how do you feel it's going now that we're kind of on the other side of this? If you even agree we're on the other side of this, how do you feel like we can move forward?
I think we have moved forward. Yeah. The last 6 weeks, I've really felt like we've moved forward. Not only, do I see it politically, I literally feel it energetically. It's in the air, and a lot of people agree with me. So, we're gonna hit back home right to Alberta. Yeah. I moved to Alberta, approximately, just under a year ago. Why? Because the spirit of freedom lives in Alberta. So I think there is huge hopes for Alberta. And I know a lot of people want to move to Alberta, because they are seeing movement forward. Action is happening in Alberta. So, that's where I would love to plant an Ezra Wellness location. I have daily requests on, hey, where's your location? Where can I go? And I mean, to be honest, we're a group of healthcare professionals that were terminated. So we actually have little to no income. And I mean, if there's anybody who wants to help with, a financial investment, you're going to work with the best of the best healthcare providers. But, to establish a physical location. And what I would really like to do is focus on blood health, the health of your blood, because your blood is, it tells stories about how you're doing, doing a pre and post blood analysis, getting interactive activities with the patient, and I just love how what you said was, IV treatments, for example, IV vitamin C. People are asking for that. We're nurses who started IVs all our careers. So it's actually a great marriage for this concept. So we are moving forward, and I hope all the rest of the provinces in Canada take note of what Alberta is doing.
So where can people, do you have a website? Is there where people can kind of either book appointments, call you guys? What is it if they want to get in touch with you?
Yeah, so the intake process, we're slowly making it larger, and we're advertising more. So I have a website. It's just a simple website, one pager, EzraWellness.ca, and basically it just gives a little bit of information of who I am, what I'm about. I have some plant-based medicines that people are really interested in. I have a phone number, a work phone number, and you're going to be texting me on this cell. And this is how I'm doing my work from Florida, actually. And then you have an opportunity to connect with me, text me, or I can call you. And this is a one-on-one nursing service that I believe is really important. And that's why I actually do it through text, because sometimes emails are delayed. And people need responses now. We have a lot of emergencies across Canada. And I even have people in Florida calling me for help. So it's not just a Canada or Albertan thing. So we have access to a lot of, healthcare providers who have stood their ground and, practice the do no harm model of care. And those are the ones that we want to continue to work with.
I commend what you're doing, and I think it's incredible. Do you have, what are your thoughts like when people talk about natural supplements, vitamins, preventatives? They kind of roll their eyes and go, oh, there's not enough research on this. What are your thoughts to that? Do you have any resources that maybe people can look at that you can point them to? What are your thoughts?
Yeah, well, I mean, let's just see what's natural. Is natural the food that we eat?
Exactly. That's a great
vitamins
question.
and minerals that we intake. Yeah. There's so much information out there. The internet is just this land of information. There's some great, some not so great. It's now up to the reader to do their critical research and actually trail back who puts out that information. So where is the source that you're reading? And then you cannot just believe anything you read or see anymore. You have to do your own research. And this is going to be a learning curve for all of Canadian clients and patients to make their best informed choice. And that's a huge, giving back the power to the patient. So and that's going to improve mental and physical well-being all around.
If someone's considering going down the private route, thinking about contacting you guys, is there any legal implications, anything that they have to worry about as far as being covered or cared after?
So, when you enter into private care, it's like a private membership association. For example, it's like a gym membership. You go to the gym, you hire a personal trainer. There's an agreement between the patient or the client and the healthcare provider. There is an agreement there that we will be working together. And that is our God-given right that we're able to do that. So, that's what I stand on. And I haven't had any problems or challenges with that model of care yet. And I don't expect there to be.
Very cool. Thank you for joining us today, Svetlana. It's been a pleasure. And I want to say, keep fighting the good fight. And thank you for joining us.
Well, thank you, Jeremy. What you're doing too is providing that truth news to the world. And this is what we need. This is where it starts. And it's just going to continue. So what you guys are doing is really great. And thank you for reaching out and having me on your show.
Thanks for watching Return to Reason. I'd like to read your thoughts in the comments section below and pay it forward. Share this video with someone. Hit subscribe and tap the bell icon so that you're notified every time I post a new video.